You'll want the table kind of mid-thigh level. And you're gonna have the patient slide towards you. If you put your fist on the table, go ahead and slide right towards my fist. Good. That's a good indication from there that you're gonna be in a good spot. You want to have them far enough off the table that you can get the knees kind of off, but not too far over where they feel like they're gonna fall off. Okay. Go behind their legs, okay? And I'm gonna do all the work. I'm gonna pick them up, and I'm going to put his ankles right in the crease of my hip. And now I've got him in a flexion rotation. I can literally move him wherever I want, depending on the response he gets. Now I'll take and I'll place my hand on his kind of knee thigh area. I'm gonna stabilize, ideally shoulder, but Adam's a tall fella and I'm a short fella. So I'm gonna stabilize, and what I'm gonna do is I'm just gonna kind of give him some rotation. I'm giving him force down this way. The error that comes in is people do this, and you're not doing anything. You need to actually twist, pressure on, pressure off. And we can ask in this position about his symptoms. And then we can mobilize, and then I'll bring him back. So I do all the work, okay?